So I had the good fortune of attending the Social Determinants of Health Policy Summit in Washington, D.C. Washington, D.C. is probably one of my favorite cities. It has a feel like none other. And so the festivities kicked off with we participated in a food packing event with U.S. Hunger. And I think the total was, and I'll have to double check, but over 8,000 meals within that hour's time. And so really got to enjoy being side by side with colleagues from around the industry and being able to do something that was so important because what I love about those events is that the food goes, we pack jambalaya, the food goes to folks that need it in the area. And so it went to a food bank in shelter in Washington, D.C. And then, of course, Rise always kicks off their events with a cocktail mixer. And so it was great getting to see different people that I haven't seen in a long time and get to chat with them. There were even some folks that stopped by that I know in the city, know them from other Rise events. And even though they weren't attending the SDoH summit, stopped in to say hello and really enjoy the camaraderie that one finds at a lot of these events. So if you haven't had a chance to go yet, you should go. If you've been before, you know exactly what I'm talking about. So I'm going to pull up the agenda and just talk through some of the sessions that I thought were really great. And the event was co-chaired by two different individuals. Krista Drobach, who was the co-chair and from Aligning for Health. And then Dr. Sandra Elizabeth Ford was a public health expert. She's the CEO of BFT Consulting and is the former special assistant to the president for public health and science, and was on the White House Domestic Policy Council. And I thought that these women were excellent chairs, had a lot of great insight based on their experience, lots to share. And I know that they also took over sessions that were later on in the conference. The keynote address was talking about the whole of government approach to SDoH and the update from the White House that was led by the Deputy Assistant of the President for Health and Veteran Affairs. And so that was Kristen Lemke Young. Again, enjoyed the focus that the White House is putting on the need to address social determinants of health and really understanding the impact on one's health. After that, there was a fireside chat, and we got to hear from Dr. Ford again and Krista Drabach on things that were going on. There was one of the contributions, I think, that Dr. Ford made that was particularly important was this playbook, this SDoH playbook, and talking about the challenges that are experienced out there, in our communities. And so appreciated that information. I know that she's recently stepped down to pursue other things, but look forward to the agenda being carried forward. There were a few individuals that were brought on stage, a lot of panels. What I really liked about this conference too is that there were no screens, so there were no slides that were presented in the room. They were available after, but everyone really talked from, and I think shared, not only their knowledge, but really their authentic selves and the work that they're doing. And I thought that, that was really, really helpful. Let's see. The session that I got to lead, I was invited to moderate a panel, and it was the federal efforts to address hunger, nutrition, and health. And on the stage with me were four individuals that had participated in the 2022 White House Conference on Hunger. And I really appreciated their various perspectives, and all of their agencies are working on different initiatives. And so on that panel, we had representation from the United States Department of Agriculture. We had representation from the United States Department of Health and Human Services, from Nemours Children's Health, and then YMCA of the USA. And then one of the things that I really enjoyed from these individuals is that not only the passion in which they approached their work, but the programs that they had been working on. And so I know that, and all the speakers had talked about this, that there's quite a bit of funding out there, a lot of grants. Alberto Gonzalez, who's the senior advisor for external engagement with the Food and Nutrition Service with the U.S. Department of Agriculture, talked about the summer EBT program, and I know that that will be important. Rachel Fisher was there. She's senior advisor from Office of Disease Prevention and Health Promotion, and was also the co-lead for Food as Medicine from the U.S. Department of Health and Human Services. And again, enjoyed the contributions that she spoke of. Allison Girdle Rosenberg, who was Vice President, Chief Policy and Prevention Officer from Nemours Children's Health, I thought had a really good comment. She had several, but just talked about, similar to us, rolls out these programs and just remembering that be ready to fail. And I love that that optimism, and I'll tell you why it's optimism in a second. But also to the courage, I think, that was behind that statement, and also the realism and the vulnerability, and this idea that it's not easy what we're doing. It's going to take a lot of effort, and being ready to change direction if needed, because knowing that we may try something and it may work and it may not. And I know that I've heard that echoed in a lot of the conferences out there that RISE hosts, and in different segments of the industry. And so I thought it was interesting to notice that common theme. I thought that the YMCA had a very lofty goal, and really respect them for that. This idea of, providing meals for children, and already, the increase that's been made. And I also asked the panelists that if I gave them a magic wand, what would they wish for, or what would they ask for? Just I think the continued support. One of the other things that was noted throughout the conference, not just on the panel that I led, but in other sessions too, was we're all doing this hard work. There needs to be a way in which we are connecting with one another and communicating, and that oftentimes we're working in silos. And I heard that across the agencies, but also too from folks in the audience. And what was great about this conference too was that not only has the attendee size doubled since last year, it's only its second year, there were over 300 participants, but you also had representation from community-based organizations. You had representation from very large health systems, all sorts of government agencies. State representation was there. But again, I still think that there's an opportunity to continue to connect the narratives. We in risk adjustment talk about risk, focus on quality, talk about quality. We even have a separate SDoH policy, or SDoH summit, not so much focused on policy, but more with individuals that work in this space and have that interest. And we had mentioned about those that attended this conference, attending that conference that's usually held in April. Because again, I think that there's an opportunity to bridge the discussion, because we need to be aware of what folks are working on, and then also to how we might leverage each other's strengths. And so lots of programs, lots of new programs, recognition of social determinants of health influencing one's health, the availability of funding and grants, a recognition that applying for those funding or that funding and those grants is difficult, and how one could alleviate some of those challenges was mentioned. There were also a lot of really great sessions on data and technology. And we had some folks that speak at other RISE events there, talking about the Gravity project and the work that was done there. And there was definitely a recognition that interoperability, I heard it echoed throughout the day, the 2 days anyway, that interoperability was very important. And so, to what extent could we make sure that health records were available so that we could better serve patients? One of the other strategies that was talked about too was this need, and I'm a big believer in this, of using motivational interviewing and then also tapping into communities, but to really get at what what the barriers are for patients. And one of the statistics that I thought particularly important that was mentioned was that you may find one social determinant, but understand that that there are 6 to 8 other social determinants behind that one that you have yet to uncover. And so, again, just that nod to the human condition is complex, and and it definitely is going to take lots of different actors to really solve this challenge. And I think that this was a really great start, and look forward to continuing the conversation and then also expanding the conversation so that we're bridging the gap between our various organizations.
Thank you, doctor. That is actually great. And you've pretty much covered everything we wanted to ask you. I really liked your question, the wand one that you asked. And we just want to lastly know that what are the very next steps that the organizations need to take to make things happen in terms of health equity, removing the barriers, and as you've already mentioned, about the grants as well. So if you can specify more on that, we would really love it.
Um, you know, there was a lot of talk about the health equity programs, and then what folks are doing around that work to improve access to healthcare. I really think that the next steps were how we were actively engaging with the patient population to solve these challenges. And so next steps really are, I think, learning and being aware of what programs are out there, being tuned in, uh, the move towards interoperability, working in ways that you could, and getting involved with the sharing of data. I also think, again, being aware of programs, looking for ways to connect. And then there was definitely an expression of needing to involve those community-based organizations. We really don't do enough, I think, to extend the hand, if you will, or reach across the divide to engage those organizations. There was a call of action to health plans. There's definitely an expectation that the payers get involved and help support some of connecting, right, or creating those conduits between the various agencies. And there even started to be some talk of how could we support those community-based organizations that are doing that great work in their community, knowing that funding for those organizations could be a challenge. And so I know we've talked about this in value-based care, but I definitely expect and see, coming down the line, monies and other ways of thinking of sharing and supporting these organizations with perhaps money that we, revenue and reimbursements that we've collected elsewhere. How can we put them back into the system? I'll say one other thing too that was a popular topic was the recognition that behavioral health was a concern, and how we would, continue to make sure that that patients had the supports that were necessary, because behavioral health too is an important component that influences our overall well-being.
So that now that you've mentioned behavioral health, I just want to know what steps can the organizations take to, promote.
Some discussion around, like I said, the recognition that there just aren't enough providers, enough
Mm,
uh, behavioral health providers. And so I don't know that I heard it from the stage, but I did hear it. We had some sessions where we did roundtables, and there was also some networking going on. But the recognition that um, we may need to lean on other providers to be able to provide those supports. And so I know that there was one person that was very vocal about the contributions that doulas make, say, to maternal health. But looking at, were there other, and I fully expect too that we'll see scope of practice expanding. We've already seen that, right? Where um, uh, other levels of behavioral health can now not only see patients but bill Medicare, and are also included in who are the acceptable providers for billing for risk adjustment. And so seeing that scope of practice expand, I definitely think we'll see that. And then, like I said, also bringing to bear other folks within the health system, like I mentioned, doulas as being an example, and then that need to ask those questions. There was definitely an emphasis on, and you know, a respect for the relationship that physicians have for patients. And that was another comment that was made too, is that in the current system, it's very difficult to be able to create some of those relationships because the lack of time that the current system allows for patients to connect with their doctors. And so, it's definitely something to focus more that I know that we'll see. And I definitely think that it will be around reimbursement for those providers, for those behavioral health providers, improving, fingers crossed. Um, Expanding, like I said, into other specialties to help support, looking at more of a connected approach across our health system and even into individual offices. Um, uh, yeah, and I definitely think that there are more changes coming, but those were some that I know that were talked about and shared, in the audience.
Thank you, doctor, for sharing your experience. And I am genuinely way more impressed by your work right now, because especially of the fact that you guys were able to do so much in just 1 hour, like raise so much, like you mentioned in the start. So thank you.